Okay, welcome back to the third panel we have today, which is about the link between COVID-19 and climate change. We're going to talk about how treating climate change as a public health issue, and also comparing the global response to the two crises, one which was very urgent and in our face, and one which has suffered from a lot of short-term thinking. I'll just let our panelists introduce themselves. Recently, I'll start with Ellen on the partner.
Hello, I'm Ellen Gute. I studied chemistry and meteorology in Germany. I came to the U of T 2015 for my PhD in physical and environmental sciences, where I studied the ice formation in clouds, which I defended last year in the summer remotely, and then continued with the Canadian Science Policy Fellowship.
Hi, I'm Patrick Egu, a Nigerian journalist based in Johannesburg, South Africa. I cover mostly human rights, conflict, social justice in Africa. I'm currently a journalism fellow at Massey College. Yeah.
My name is Wency Liang. I'm a health reporter with the Globe and Mail, and like Patrick and Michael here, I'm also a journalism fellow at Massey College.
Right. So can I get that poll for a second here? This scientifically accurate poll we have about how do you feel about everything with climate change? And 64% have a call to action. Angry and helpless, which I think is the equivalent of the apocalyptic option in the previous poll, is 18%. Opportunity for change, 18%. And don't really care, thankfully, a big fat 0. So I'd like to talk about viewing climate change as a healthcare issue. I mean, there's a variety of fronts for this, about pollution's effect on air quality and water quality, about the encroachment of human development on national habitats, and therefore increased chance of pathogens jumping species to species, etc. So just broadly, Ellen, I'll start with you. How should we frame climate change as an immediate healthcare issue?
I think you raised it already, like all the points. It's like it's really impacting air quality. That's the air we breathe, or the water we drink. So this has impact on our bodies. And yeah, I think it's clear. It has so many implications. Also now look at all the extreme events that we already have, like with the flooding. We have those things on top of COVID. So we have those on top of a big health crisis, with all these additional effects that it has, what you already mentioned on the air pollution and such side. So I think we see this interconnectedness. We see this much more clearly. We see all these like floodings, wildfires happening during a pandemic, so we can't isolate those things anymore. And I think that became very apparent. So that we have to frame it. Those are crises that interact and that add up on like the burden on the people living through these different extremes.
How does that manifest itself in your work or what you observed in your direct experience?
Sorry,
your direct experience, how does that manifest itself in your work or what you've learned?
In my research, you mean?
Sure.
Well, my research is very fundamental. I look at really the physical, microphysical processes in clouds. I think learning more and understanding as a meteorologist, understanding what is sort of going on in the atmosphere and following closely all the reports that come out. It's this call for action that is very clear. Also, with the latest IPCC report that just came out on the physical basis, it was very clearly stated that we as humans we cause climate change, and it's faster, it's more rapid, and it's widespread. And it's going to accelerate in the coming years, that we must act. But also coming back, so it's really, it became more clear, it's this call to action, but also what in the poll, like with the 18% on that people see the opportunities. I think that would be really nice, and I think that's what I try to sort of message in also personal conversations, that we see this opportunity is much larger also for like health implications. So if we solve if we address the climate crisis and if we lower pollution levels, we will benefit for our health. And around the globe, yes, we have all different situations in on local scales, but I think that we see this as an opportunity also to improve our health and be better prepared and improve the living and the working conditions, make them healthier, more active, and such. So I think there is this like opportunity, yes, a call to action, but I think strengthening like that narrative around the opportunities and that we make them more, we can collectively better envision them. I think that is important.
Patrick, I want to ask you about perceptions of climate change in Africa, and as we all know, it's countries like Canada and the U.S. and Europe and China India that are large polluters, and the effects are felt in places like Africa, increased desertification. How is public perception in Africa of the urgency of climate change?
Okay, quite urgent, I must say, and currently there's growing concern in Africa by political leaders to fight climate change and participate in global events like the conference currently happening now, and contribute whatever they can, conduct studies in order to reduce the impact of climate change, which is very much felt in Africa. And I mean, there's growing awareness generally about the impacts of climate change.
Has that changed more recently, I'm curious, like in the last couple of years, or how has that issue developed?
Pretty much, I think it's a recent trend. In the last decade, the awareness about climate change is very low compared to now. I mean, you have global activists raising awareness and trying to educate and inform people about the negative impact of climate change, flooding, and the rest of them. So African leaders are, actually taking action, participating in events and contributing whatever they can, both financial and, human and intelligence towards the fight, against climate change. And for example, in Nigeria, where I come from, climate change is a big issue. I mean, it's a big issue because Nigeria is a country of more than 200 million people, and one of our major sources of income is oil, which, I mean, Nigeria started exploring oil in the 1950s, and in the Niger Delta region in Nigeria, you have gas flaring, you have pollution, you have contaminated water, you have, as a result of the activities of multinational oil companies like Shell, Total, Ajip, and the rest of them, there have been hundreds of lawsuits against these multinational oil companies. And many studies have been conducted, many investigations, many researches have been conducted to show, the impact of pollution and gas flaring in the Niger Delta region, even the impact on infant mortality, the impact of, wells and drinking water sources have been contaminated. Fish in the oceans have been contaminated, and fishermen they go to the stream to the river and to fish, and after doing that they sell it in an open place in the market, and people buy they consume these products that have been contaminated and stuff like that. Farmlands, people no longer go to the farm in the Niger Delta region where major oil exploration is happening, and I mean, it's really a big issue in Nigeria, and I can say in Nigeria there's growing awareness. Nigeria's president, Muhammadu Buhari, just left Nigeria 2 days ago to attend the
COP.
the COP 26 conference currently happening now. So, I mean, many studies have been commissioned and many panels set up in order to investigate and contribute to the growing awareness of climate change in Nigeria particularly and other parts of Africa.
Wency, I'm curious about your view on long-term and short-term thinking in terms of in treating climate change as a crisis. Again, like I said off the top, with COVID, it was something immediate, it was in our face, it was something we were forced to deal with. Whereas, unlike in Nigeria, where people could see immediate effects of fossil fuel exploration, for many Canadians, the devastation of parts of Alberta is out of sight, out of mind. And I'm just curious about the mentality of public policymakers, of society in general, in terms of thinking beyond the short-term economic interests to long-term solutions.
Yeah, that's a great question. I think, in my coverage of the pandemic, one of the big challenges is that you can't see it. And the big challenge for journalists is to try to make this story something that people can see, because it's happening in hospitals, it's happening, the devastation is happening in long-term care homes where people are not going, and we cannot go there to show people because of us posing a risk to patients and vice versa. So I think that the two are very similar in that way. I think, one of the fundamental issues around the pandemic, which is similar to climate change, is the idea of, to tackle it, is the need to think beyond ourselves and to think of, to put other people's interests ahead of our own. And I think that's the great challenge in trying to harness this virus, and it's also the challenge when it comes to trying to solve the climate crisis.
I mean, it seems like there's a larger failure of empathy in general, certainly among kind of like the anti-masking, anti-lockdown crowd, as well as people who don't experience the immediate effects of climate change.
Yes, yes, exactly. So there's that facet of it, and the other facet too is that similar with the pandemic and with the climate crisis, is the need to rely on governments and rely on policymakers to make these big decisions. Like, each of us can only do so much in kind of solving this massive problem that really requires it requires people on top making decisions for us.
One of the great questions of the pandemic was, what is normal, and should we return to normal? And as the last panel was talking about, it exposed so many inequities in society in general. But in terms of climate change and pollution and other environmental issues, there's such a rush to return to normal. And during the pandemic, we saw decreased air pollution. I believe it was in India. It was unprecedented the amount of clean air they'd had for first time in decades. Reduced air travel, wasteful industries like cruise ships, which is the last industry I want to see bounce back. But it just seems like, but cruise ships were one of the first priorities. Like, it's just like, let's get the cruise ships going again. Why? Why is that why are we even thinking about that? This would be the ideal time to rethink air travel. And yet, just when we've been deprived of our creature comforts that we've had for decades, it saddens me somewhat that we're not choosing that moment to re-examine those priorities. Does anybody have any comment on that?
I mean, Megan, you can speak a bit on sort of the effects all these restrictions had on all you mentioned the emissions. Yes, we saw improved air quality because we had less traffic, we had less particulate matter in urban centers, but it was also clear. So also the greenhouse gas emissions, I think, dipped by 6.4% global average. That was published in a short Nature overview. But it was also apparent that it bounced back. It comes back to compared to 6.4% less than compared to 2019. But it bounced back even at the end of 2020, when we went in another wave of restrictions. Our economic activity and industrial activity sort of picked up again. We got used, and how do we still run certain things compared to the very beginning of the pandemic, where a lot of things were really strictly shut down. So it shows, if we go back to this normal, we continue with our emissions, we continue having the air quality issues, having then poor impact or negative impacts on health. But it also, you mentioned we got to see very obviously what is wrong or what we can fix, and also what is really necessary. So we talked about the essential workers. We realized, yes, we need food, and we need energy to heat or cool our homes, depends on in which region we live. But I think use this, as bad as the pandemic is, as an opportunity to really rethink those things, and not trying to go back to this normal because we see that normal wasn't good and the pandemic laid that bare. What are all the things that weren't good? So I still hope, I try to be optimistic, that we see more the narrative around the opportunities, and let's change this, make it better for the health, for the working conditions that many people face, like in the factories, if they get to different jobs as we decarbonize the industries and the economy. I think that this narrative about the opportunities, because now we can't, after the pandemic with all we saw that I just mentioned, we can't ignore that, or we can't pretend we don't know it or don't see it anymore, because it was so obvious in our face. But it's on us as then the communities, and that's where we need to work together and think beyond our individual selves. What are we doing with it? And how do we communicate it? Yes. Do we communicate enough how we envision that future? Because only what we can sort of envision, we can reach potentially. How do we talk? What are we doing as a society, as humans? What are we doing with all that information, all that we saw?
Yeah, and I think just to reiterate the role of leadership in all this. I mean, when Patrick talks about what's happening in Nigeria and oil companies, I mean that requires government intervention. We can't, as individual citizens, we can't do something about that. Same as you could go walk into a room with yourself wearing a mask, but that's not going to do anything for the pandemic. So leadership is really important.
I'd like to say, in response to Wency's comment about leadership and taking action, which I think is very important. But in Nigeria, for example, I mean, coming back to Nigeria again, I've pretty much followed, the pollution of the environment, especially in the Niger Delta region, where oil exploration has been going on since the 1950s. So personally, I think it's a matter of balancing between the economic side of it and, saving lives. The government has set up commissions, and including the United Nations Environmental Protection Agency, carrying out an impact assessment on the impact of pollution in the region. I mean, every country wants to make money, So Nigerian government makes a lot of money from these multinational oil companies, and personally, I think the pollution is not going to stop, because that's our major source of income.
Is that the number one industry, or what is there anything?
And that's the number one industry in Nigeria. We have other industries, but we are heavily dependent on oil. I mean, everything we do is all about the oil money and stuff like that. So the government can make moves to take action, to maybe appeal to the international community, for example, the United Nations and stuff like that, to show that they are willing to do something about the pollution. But we know that they want to make money, and they make a lot of money from Shell, from Total, from Ajip, and the rest of them. And it's going to continue, because the oil exploration can never stop. I mean, if it stops, then how are they going to cope?
I just want to take a moment to thank UT for announcing they're divesting from fossil fuels by 2030. That was big news this week, so that's relevant to what's happening right here. What's your anything to add to new normals?
To new normals? No, please move on.
So what kept me awake with apocalyptic thinking for the last 20 months was, among other things, thinking about how we dealt with both these crises. And I mean, again, from the other panels, if we can't even coordinate provincial health data from province to province, if we can't work globally to solve this problem, there are many ways in which we did work globally to solve the problem. And yet, when we were talking about political reckoning, we were talking about Western countries with large vaccination rates. As we know, most of the world has yet to be vaccinated. So I feel like we haven't really grasped this problem on a global level, which makes me sadly pessimistic about our ability to do this together, because money will always talk, and it's very hard to turn that large ship around. I'm just curious about my other panelists, if this, were you as pessimistic as I was in the last 20 months about how our approach to COVID might affect our approach to climate change, or did you find optimism there in the areas in which we did come together? Ellen, I'll go to you first.
As I said, I try to be optimistic, and I think that's what we need to be. It's our future, it's at stake. I think in terms of it was talked a lot in the previous panels on the data sharing and such, and how much we understood. I think the big difference, first, the climate crisis is way bigger than the COVID crisis, and I think we need to be clear. The pandemic is defined as something that lasts several months. Yeah, we might can sum it up in maybe 2 years plus. But climate change is going to be something for the decades and centuries to come that will impact human life on this planet and the natural animals and the plants. I mean, the big difference, I think, yeah, it's bigger, but also in terms of what was mentioned on the data sharing and the information with climate change, we have the data. The latest IPCC was really making clear, okay, yes, humans are causing this, it's more widespread and faster. I said this at the beginning. For that, we have research. Compared to COVID, we have research that needs to be sort of ad hoc. We need this now. We don't know much about the SARS-CoV-2. Climate change, that research is going on since decades. And we have such international panels as the IPCC, we have the IPVS for the biodiversity and such. So we have globally, we have those models, we have this data sharing. I think that is one big difference. So we know this. We need to act on it, and we need to find. Yes, we will need to solve certain problems. I think what is also important is the physical science essentially is clear. Yes, we need to do further research on tipping points and such, attribution studies. But we need to interact more, also interdisciplinary, I think. So with the political science, with the social science, to say what does it mean and how do we inform each other and how do we sort of together find solutions, and also work with the communities from the very local level to the national and international level. But I think in that sense, in assessing the situations and assessing the data, they feed into big international collaborations and data systems. We have that, and I think that's a difference to the pandemic, where everything was suddenly we need to know something very new. So I think we have that infrastructure, and that I think should give us some hope that we use it right, that we make the right decisions also on political levels, to use what we know, what science has found out, and build the future.
Patrick, optimistic, pessimistic? Glass half full, glass half empty, glass will fall off the table and break anyway? Where are you?
Well, I'm optimistic, if I must say, because we've seen what we could achieve. Well, not really achieve by the reduction in air pollution during COVID lockdown last year and even this year. So I believe it all falls down to raising awareness that, even if we return to normal, that's post-COVID, that, we could reduce emission, we could, have a clean air, we could, have a better environment, not only for ourselves, but for the generation yet unborn. So I'm a kind of optimistic, but more needs to be done, and that's why the COP is currently holding, and future events are scheduled to be to take place around COVID, around climate change and other issues. So more action, more global action, like we're seeing currently, and more needs to be done. People, we need to educate people. We need to raise awareness. We need to do more beyond what we are doing currently. But I'm optimistic, and that's, post-COVID, everything will be known.
Lindsay, are you sleeping at night? How's it going?
Oh yeah. So I if you had asked me maybe 6 months ago, I would have been in the apocalyptic camp. Since then, I feel like I do have reason to be a bit more hopeful. But that is learning about the idea of a One Health model, which is kind of gaining a bit of movement. And with the One Health model, it's the idea that that in order to have healthy humans, you need healthy animals, you need a healthy planet, you need a healthy environment. And when a perfect example of this is the threat of superbugs, which is like antimicrobial anti-drug resistant, or sorry, drug-resistant antimicrobes, which is a huge threat, and this keeps me up at night. The World Health Organization has cited estimates that by 2050, superbugs will be responsible for 10 million deaths per year, which makes COVID just a walk in the park by comparison. And one of the ways to solve this this crisis in potential crisis in superbugs is, it's not just overprescribing antibiotics to patients in humans. It's also curbing antibiotic use in agriculture, and also reducing or being able to reduce runoffs from factories that create drugs in the first place. So I think my optimism is this idea of like shifting our way of thinking of things, and I think that really is what needs to happen. Yeah.
Right. How's our time? We're just checking our time. We're going to go to some questions from the floor. The boss has a question.
Yes, my question is about this. The previous panel was very much about human rights framing of public health. And my question is, if we were thinking of greening public health, what would we look for? One of the issues, for example, was the idea of having manufacturing of vaccines closer to the delivery of vaccines, as opposed to have them all in the Western Hemisphere, and then using big transportation to transport the vaccines over to a different place. So some of the ideas of what would a green public health response look like from your perspective?
I think there is a large plant in India, so it's not entirely all in the Western world. But that's something else I've thought about. I thought more about waste. I mean, we've all seen the streets littered with masks, PPE equipment being not reusable. I think that's something that we have to think about moving forward, because again, as soon as it hit, suddenly it was like disposable everything, plastic knives, forks, takeout containers, all the hospital gear. I'm not looking forward to the report on the increase in waste and how much of it is currently in the ocean.
I think, Natalie, that's such a great question, and I'm not really sure I have like a great answer to it. But I feel like, in some ways, doctors are kind of moving in that way in terms of doing things like social prescribing, or like, during the pandemic, we saw just how valuable being out in the fresh air and like going out into nature was for our mental health. And I think, the more we give people a chance to value nature and to be in nature, that will go back to that One Health model, where we will appreciate, what's happening around us, our environment, and maybe encourage us to protect it.
I also think of urban planning, and I think of how a lot of public spaces were developed in the wake of the influenza pandemic 100 years ago. I feel very blessed to live in an area with a large amount of public space and parks, but there's sections of Toronto where that's not true, and there's certainly sections in other urban centers where that's not true. And I think what Wency is saying is really astute. There's a question over here.
My question is kind of for you, Wency. I don't know if you have an answer to this, but I think what you were saying about this One Health model really also relates to exactly what Michael was saying, that we found this like we have a pandemic, so we're like, let's just have this solution. We'll just make a whole bunch of plastic stuff and like put it on our faces and throw it in the garbage. And, rather than thinking about it, I think in this whole holistic way that you were talking about. And I guess, I don't know if you want to answer this, Wency, or somebody else wants to take it, but what do you think is the thing that's stopping us from getting there? Like, why are we looking to these quick or scientific fixes rather than thinking about health in the way that you're talking about, as like a system, as like one thing?
I think it's because we tend to think of health and healthcare as we look at acute. It's an acute model. You know, we see a problem and we try to fix it. And it's just kind of the way that our healthcare system is built. It's the way that we just think about problems, and it's the way that we think about the pandemic too. It's like, you know, how do we get the numbers low so we can open everything up again? And I guess it's just. It's just in that mentality. We haven't gotten there yet to that One Health sort of way of thinking.
Do you think it's related like to how our economic system works? And
I think that's beyond me. But
Nancy, can you solve all the problems?
But no, that's a great question though.
Ellen, did you have something to say?
I think just to add, I think it's important to also always reflect who has access to those solutions. And you mentioned like not all parts of Toronto have green spaces. And I think for that, being in communication in the communities, between different communities, to sort of understand what is feasible or what would their needs be. Because I think we saw this in one of the first polls, I think after the first panel, how has the pandemic sort of impacted us, and I think it is moderate, so I assume the average, maybe this is a weird assumption, but is fairly privileged. So, because if we weren't that privileged, we would probably have clicked the box for more severe. So I think always having this discussion, who has access to solutions, who has access to sort of quick fixes and can buy all these new masks all the time, for example. How do we sort of all together kind of find the solutions and discuss what is feasible and what can be built in the respective communities, to build sort of the better future.
I think that is our time. So I'd like to thank Ellen and Patrick and Wency for being on this panel.